Teenage Mental and Emotional Health by Nicole Robbins for the Community Health Education Methods course at the Mississippi University for Women during the summer 2014 summer semester. Shown here is the table of contents for this presentation. Number 1, the definition for mental health. Number 2, common mental disorders, specifically including depression, autism, and anxiety, followed by a chart that has the warning signs, followed by another chart of determinants and outcomes, followed by number 5, help and support, number 6, alarming facts and statistics, 7, final thoughts, and 8, references. According to the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. There are a variety of mental disorders, but here shown are some of the most common ones, including depression, anxiety, schizophrenia, bipolar disorder, obsessive-compulsive disorder, or for short OCD, eating disorders, attention deficit hyperactive disorder, or for short ADHD, and autism. What is depression? According to the CDC, depression is characterized by depressed or sad mood, diminished interest in activities which used to be pleasurable, weight gain or loss, psychomotor agitation or retardation, fatigue, inappropriate guilt, difficulties concentrating, as well as recurrent thoughts of death. Some of the adverse effects of depression include smoking, substance abuse, physical inactivity, and sleep disturbances. What is autism? The American Psychiatric Association states that autism spectrum disorders are a range of complex developmental disorders that can cause problems with thinking, feeling, language, and the ability to relate to others. They are neurological disorders, which means they affect the functioning of the brain. How autism disorders affect a person and the severity of symptoms are different in each person. Studies show that 1 in 68 children are diagnosed with some form of autism. And the specific characteristics of autism include difficulty with communication, difficulty with relating to others and situations, and repetitive behaviors. What is anxiety? According to the CDC, anxiety disorders are characterized by excessive and unrealistic worrying about everyday tasks or events, or may be specific to certain objects or rituals. Some symptoms include overwhelming feelings of panic and fear, obsessive thoughts, and various physical symptoms. Specific types of anxiety include panic disorders, phobias, and generalized anxiety disorder. Here is a diagram that displays the various warning signs of a mental or emotional illness, including anger and worry, excessive grieving after a death, feelings that the mind is being controlled, substance abuse, eating disorders, hurting others or vandalizing, reckless actions, self-inflicted injuries, and suicidal thoughts or attempts. Here is the chart from the 3rd edition of the Chronic Disease Epidemiology and Control textbook displaying the determinants and outcomes of mental illness. The determinants include adverse events during childhood, genetics, family history, employment, low income, not being married, and history of mental illness. Example outcomes include suicide, obesity, substance abuse, disability, and premature death and/or disability. For those struggling with mental illness, there's many outlets for help and support, including mental health experts, which include psychiatrists and psychologists, which will provide various forms of therapy, professional health educators, medical professionals such as nurses and doctors, family and caregivers, educators and school support staff, and plenty of help hotlines. Here are some alarming facts and statistics. In 2012, almost 16% of high school students reported having seriously considered suicide. Also, suicide is the third leading cause of death in youth ages 15 to 24. Over 90% of children and adolescents who commit suicide have a mental disorder or illness. And finally, anxiety disorders are highly treatable, yet only about 1/3 of those suffering receive treatment for many unknown reasons, but also the negative stigma behind mental illness. For my final thoughts on this presentation, I chose the peer-reviewed article titled Teacher Involvement in School Mental Health Interventions. This is revolved around the fact that schools are large providers of mental and emotional health services to children and adolescents. And an extracted quote I got from this article was that in 2005 and 2006, the national survey by the Substance Abuse and Mental Health Services Administration revealed that approximately 3 million youths received school-based services for behavioral or emotional problems during the 2005-2006 academic year. In continuing my final thoughts, the purpose of this research article was to investigate the extent to which teachers are A, the primary school-based service providers, B, collaboratively work with other professionals to provide services, and C, what levels of interventions within the response to intervention RTI framework apply to these interventions. And in conclusion, these findings suggest that teachers have been actively involved in school mental health interventions and that they are more likely to work as a team with other professionals than as the sole providers of these interventions. The next 3 slides are my reference citations for my online, print, and image sources. Thank you very much for watching this presentation.